Hello viewers, I'm Datuk Dr. Prethima, and if you see all the snowy effects there, I'm not in any winter wonderland. I am sitting in Bangsa at my Ageless Medispa and Clinic, and I'm speaking to you today on Facebook Live. And for all of you, we are in MCO, but we are still working 10 to 6 every day except for Sunday. We are closed. And if during this time you have any pressing questions, you can contact us, or you can also call us for any other inquiries at this number. Okay. Today is a very interesting, important topic because we are running this promotion for MCO and also Chinese New Year together. We were doing these promotions on skin boosters and fillers and certain collagenizers like Ilansei, and it was very interesting the kind of questions that came up. It was all about asking what is the difference between all these different things, what is suitable for me, what is the downtime, what result do I expect, how long will it last, the kind of questions. So then, of course, someone has practiced these things more than 25 years, it comes to my mind that yes, everybody needs to know from scratch what these things are. So what you are to know about fillers and collagenizers and even skin boosters, we are going to be giving some explanation about these things, okay? And of course, we also want to talk about the industry trends, because compared to 20 years back when all these things became super popular, fillers and Botox for example, now the trend has kind of changed because there's a lot of other things that has also come into the market. Like now there's thread procedures that can do more lifting and a very gentle filling. So sometimes for this kind of things we are using products like the Aptos thread with, if you can see it here, it comes with hyaluronic acid. Most of the contents of the fillers is generally hyaluronic acid, but it's interesting where the trend is changing. Instead of just pumping up volume in one spot of the face, which used to be the case before, either it was the cheek or it was the nasolabial labial area, or it was some depressed area of the face, that is what people were coming for. But as we went into the signs of aging, we started to give a lot of explanation to patients, telling them that it is not just filling that you need when you are aging. Sometimes it's also improving your skin, which is where skin collagenizers and latest products like Profio is becoming very, very, very popular. And other than that, of course, threads with hyaluronic acid is very, very interesting because it just gives a bit of a lift, subtle lift, and also a beautiful hyaluronic glow on the skin everywhere where the threads are placed. Of course, again, we have seen over the last 10 years or so, as cosmetic practices came up, and a lot more compared to 10 when I started, now it's possibly 1,000. And you see that there's a lot of what we call filler phases or pillow phases, where fillers have been overdone. So sometimes it's just like filler all the time. Filler is not the end-all treatment for everything. There's always an indication, and that's why you need the help of a good doctor. But because of this, filler phases came up, many people freaked out, right? And they started to say, I don't want to have that kind of chubby looking face. Okay, I want to have a more natural anti-age skin. Then there is products like Ilansei, which is a collagenizer with a subtle filling element in it. Products like Profio, which is a very, very high-tech engineered hyaluronic acid, which just injected in 5 spots flows through the skin to give a very gentle volume augmentation, but most importantly gives the beauty of the skin, which is a bit of the lifting, collagenizing, and also hydration of the skin, which gives you that sparkle on the skin, which I think is very, very important. So the trends is changing. Okay, so one of the frequently asked questions recently in my center when people contacted us after we sent our promos was, what's the difference between Ilansei and Profio? Okay, Ilansei is a combination. It does 2 things at one go. One is there is a plant-based filler inside. Albeit lasts only 6 months, but this gives time for the body to promote the collagen, which is coming from the collagenizer, which is also inside that same syringe. So it's just one single injection and you're getting both a volume filling, and it also gives you that collagenizing effect. So what does a collagenizing effect do to your skin? It actually gives you beautiful glow on the skin, a slight lifting, and it gives you a filling effect which is longer lasting than what fillers alone can do. Okay, so this is a very interesting thing, and Elancey comes in S for less than 1 year, M lasts about 2 years, E and L, those last longer, 3 years and 4 years respectively. So Elancey is a collagenizer more than a filler. So if you're expecting one area of your depression to be fully filled up till it's completely flattened, then maybe Elancey is not for you. Then you will go for product like fillers. Okay, we'll talk about fillers, but let's talk about Profio. Profio is going to be just hyaluronic acid. There is no collagenizer inside, and it is can't be done in a single injection technique generally, because there is some focal points where we are going to put it at the temporal area, at the cheek here, because most people have a little bit of flattening here as they grow older, and then their eye defect comes down to the cheek, giving like a cut across the cheek, and then of course one across here so that it flows down your laugh lines, and one here so that your droopy lips will be upturned into a nice smile, and then another one at the cheek area here so that this jaw area can be lifted up. And this is 5 points, and that's very minimum downtime, maybe small bumps immediately after the injection, done under local anesthesia, so there is no pain at all. Elancey can be done with a single point technique. My general technique would be just one single point somewhere here, and then from there I can go to the temple areas, I can go to the cheek, I can go to here, wherever the person needs the filling and the lifting and the collagenizing. Okay, the next common question that we had is, because we have two very popular fillers in our center that we use. One is alginous. Alginous is 100% pure organic agarose gel, and it does not have any chemical links in it to keep it as a gel formation. So it's a very special method of making a gel from a sea algae. So it's 100% vegetarian and very less chemicals used to bind it together. So this one is natural, and how is it different? It also helps a bit of collagenizing, so it makes the skin quality better. So sometimes when I inject it into wrinkle areas, even though we are not injecting directly into the depression, we are injecting around it or under it, you still see the skin wrinkle disappear over time. So you find that it's a very nice filler for these users. And of course we have 3.5, which is very strong, so you can hold your cheek up or your temple part up, and it lasts longer of course than the 1.5 and 1, which can be used around the eye or lips for a very soft, gentle, soft filling. Okay, the other product that we are talking about is Teosol, and Teosol is using RHA technology, which is rheology, we call it. That means a very soft kind of filling without too much of particle, too much of irregularities when we put into the skin. So it's a very smooth filling effect. And Redensity 2, for those of you who are already my patients, if you have problems around your eye and you have tired looking eyes and you ask me what should I do, I always go for this, basically because Redensity 2 is specially produced for the eye area. Sometimes I use it on the lips as well, because it's also mixed with amino acids, 24 different kind of amino acids and vitamins, and the important ones being A, C, E and K, which all have properties to lighten skin colors. So when you have deep dark depressions around the eyes, or you have very dark smoker's lips, then this can be a very special way of hyaluronic acid together with these vitamins. So additional boost of getting your skin brightened at the same time. And of course, Redensity 1 comes into the category of skin densifier. Let me talk about what's a skin densifier. A skin densifier is what makes your skin more plump. So who should be doing skin densifiers? Those people who have very dry skin or fine lines or wrinkles in the skin. So these are wrinkles that cannot be corrected with products like Botox or Xeomin, which is a pure no animal ingredient and no antibody producing toxin inside. So this is a very safe way to inject inside. Of course, my other filler which is very popular with me is the Juvederm brands. I love the Volux a lot because Volux will last a lot more longer than any other filler, So sometimes for the chin areas, for jaw areas, even for nose to hold the shape, then I would like to use the Volux. So there are different what we call as G prime, so different kind of textures to the fillers. So according to that, we need to choose the fillers. So from listening to me, I think roughly you understand why you should have a doctor you can trust, who can exactly know what your skin needs or what your face needs according to your wants and needs. So it's not about I have a lot of boxes of this and I want to give you this for everybody. No, because many people get into trouble after injecting fillers is because they have, sorry to say, gone to the wrong doctor who does not have a wide array of fillers readily available there, or sometimes the doctor is new and they do not know how to choose the correct filler for which part. Okay, so if you have a very deep depression, and even though Redensity 2 is a great product, if I go and put it there, you'll be dissatisfied with the result. Or you are telling me, I had this very deep depression, I want this filled, and then I'm telling you, you do a collagenizor. It can lift up and give a smooth correction, but it cannot give you that much of depth correction. So then we always have to know which filler to use for which product. So sometimes this injection techniques wrong. Sometimes the product itself, some of them may not be in any of these. All of these are FDA approved fillers, and they also registered with our Malaysian Ministry of Health for safety. Okay, so if you find that somebody is not being transparent with you when injecting, refuse to show you the product they are putting into your skin, then I would suggest you should walk out, because anybody who's doing these things into your skin should be transparent. There's no reason for them to get upset. Oh, why you must ask, because a lot of times people who come to me with complications, and when I ask them, what did you inject in your face? They didn't know what they injected. So I have a feeling when somebody is not being transparent, there is something illegal going on here, or the doctor itself is not certified or trained to administer these procedures. Okay, so what are the type of doctors you're looking for when you want to inject fillers or collagenizers or Botox or Xeomin? You have to, number one, see they are a doctor. Okay, there's a lot of beauticians posing as doctors. Please be careful. Look for their annual practicing certificate, look for their clinic registration, because fillers and Botox should not be registered in hairdressing salons or beauty salons, and it's happening all over the place, and it's causing a lot of problems. Not only it's causing problems to these people like yourself who just look at these images, think this is a common reaction of all fillers, which is not. It's a common reaction of all Botox, which is not. If it was, I would not be sitting here talking to you after practicing this for 25 years, because we have done great treatments on our patients. That's why we have all our repeat customers and new ones as well by word of mouth. So you have to go to the correct place. And the second thing, which was introduced since 2017, is you have to have a license to practice cosmetic medicine in Malaysia. Not in all countries, but in Malaysia that is now a must. Okay, so that you must look for as well as in the doctor. And then I already spoke about FDA approved and registered products. So look for the brand, or when you ask your questions online or over the phone, ask for what product will be injected. Will they be able to show the product on injection, and will they be able to also show the doctor's credentials if you're not sure about it, and also make sure that they will be available to talk to you later on, because sometimes small side effects can happen, like a little bit of swelling, a little bit of redness, small spots of bruising can happen. It's not permanent, but sometimes it can go on for 2 to 3 days, and in worst case scenario, if it is untrained hands that is doing it, can go on up to 1 week as well. But at least you know that the doctor will be available. Don't go for fly-by-night doctors. Don't go for these doctors who are injecting, so-called doctors. I don't know how any doctor can inject in an unregistered place. Then there are doctors who are injecting so-called in houses, in shopping malls, all over the place. So these kind of doctors, you may not be able to find them if there is a problem. Okay, and products like hyaluronic acid, if sometime it was injected in the wrong place, this is another set of complication coming. Injected at the wrong level, because all products have to be injected at different areas of the skin. So for this, if sometimes a bit not very well trained doctors, they can make small mistakes early on, so at least you know that they are available to melt the filler off using the hyaluronidase, which is a very simple, easy method to dissolve fillers as well. And for now, at least do not go for any permanent fillers, because there's a lot of these cheap products. I say, oh, that person is injecting very cheap. Be aware there is silicone oils, it's very easy to inject. Anybody can take it and put a needle into you, but that will cause a lot of lumps and bumps that will get worse over the years, cause a lot of complication, and your skin will never recover after that. So don't go to this kind of people injecting cheap products, because you want good things done on your face, you have to go for good products, and they come with average pricing. It's not extremely expensive, but there is an average pricing, and you cannot expect something that costs 1,500, it can be discounted to 1,200, but it cannot be discounted to 100 or 200. It's not possible, because there's a cost to it, right? So you need to be aware of this. Nobody who's injecting cheap is doing it as a mercy injection or out of charity to you. They are doing it cheap is because it costs so cheap. And why is it so cheap? Because it's not registered, it's not FDA approved, and it is not actually hyaluronic acid. It's silicone oil. Silicone oil is used to lubricate machines, people. It is not used to inject into people's faces. But we know a lot of celebrities, well-known people with their images looking lumpy all over the face is all done with silicone oils. Okay, it depends. Some beauticians are so clever, they can tell you, they can upsell you and charge you very expensive as well. Go to professionals, and they should be professional with you. Okay, so I think we have kind of given you some explanation. I think there's a couple of things maybe I have not spoken about is some of the meso products that we use on the skin. Okay, the meso products we use on the skin would be RMDA. It's very small, but this is my favorite product. I use it after lasers. I sometimes use it in my injections or skin lifting products. There's a lot of vitamin mixtures inside, and there are skin healers inside, and all of this together will lighten or lift your skin. These are injected in tiny meso injections all over the face. So sometimes there can be a little bit of downtime because of multiple injection spots. But what we do in our center is we have certain delivery machines with very gentle microneedling. We are able to penetrate it very deep into the skin without having to inject painful injections all over the face. So we do have discounts for our Redensity one combined with our the skin healing injections together and skin brightening injections together, and at the moment we are charging like 1,500 for a whole face. If your face is a bit small, you can even do a little bit along your necklines, and this is a very good deal for you to try. It will be something good for you to try and appreciate if you're not ready to put in fillers yet. But if you're ready for fillers and Botox, we also have a great promotion going on for that. So any filler 1 mil we are giving you at 1,200, and if you add for 1 syringe of filler, if you add one part of the Botox, and we are using either pure Botox or Xeomin. These two are original FDA approved. They are not China made or Korean made brands, and this we only charge 300 per part. So one part is defined as your frown line, you know, this one, your forehead is one part, your eyebrow lifting is one part, your laugh lines is one part, you know, or your, you know, a little bit of your jawline areas is one part. So you can always get the filler at 1200, and then the Botox would be only charged at 300 per part. So please do call us at this number if you are interested to ask more questions, more explanations. Myself or one of my staff will be readily available to answer your queries, and we cannot leave the table without talking about Kebalin. Okay, Kebalin is something we put on the face sometime to add on volume for anti-aging, but in Asia we also have a lot of chubby faces and under chin areas. So Kebalin is something that we use to actually help to melt fats around the face areas. Okay, so it comes in ampoules, and the doctor will have to take it out and inject it into the fat layers. This should not be injected into skin. It will leave holes in your skin. But if you have chubby face and you're suffering with you want to make your face look slimmer and your jawline appear sharper, then we can also do face slimming using this. So I think we kind of covered most of the injectables around the face. So I think I have some time now to just answer a couple of the questions. I've been told I don't have much time, so I have to just answer a few questions today. Okay, how do you treat warts? Okay, I laser them basically, unless it looks extremely suspicious. Then I will have to cut it and stitch it and send the wart to check with the lab. But most of the time, if it's simple wart, either it's a viral wart or it's due to too much of wear and tear. Sometimes you get warts around the feet and the hands, elbow areas, then we just laser it off. It's just like 10-15 minutes job. Do you offer chemical peels for skin conditions? Absolutely. I started doing chemical peels first before everything, so you can say that I'm an expert in chemical peels. We offer all sorts of chemical peels for acne, for anti-aging, whole body lightening or whitening chemical peels, which will take about 2 hours. We treat everywhere from the neck to the toe area, lightening everything, paying special attention to dark areas like underarms, groin areas, buttock areas, knee joints, elbow joints. So we have them, and we also have the very gentle retinol peels for skin brightening and glowing. Okay, does a man go through menopause? Yes, something like that, but it's called andropause, people. It's not called menopause, it's called andropause, because female is menopause, men is andropause. But andropause normally happens slightly later compared to female. So most of the time andropause is about 65, 70, that's when it happens. For female, sometimes it starts even earlier nowadays, 45, roughly 50, and it gets worse over the next 10 years or so. So it's a lot earlier, and this is one of the reasons why a woman ages much faster than a man. That's a sad state for being a woman, but then for many of you know, I have a gynae practice going as well. So if you have any issue with menopause or andropause, you can always come to me. How often should a woman get a pelvic exam and pap test? So this is a very important question. Every year is a must. And if we notice that you have any atypical cells, that means suspicious cells there, or infections that is being treated and have to redo the test again, please follow schedule by your doctor, and they will tell you when they need to repeat the pap smear. Sometimes it can be 2 months, sometimes it can be 6 months, but never later than 1 year. 1 year once you need an ultrasound scan by a doctor, pelvic exam by a doctor, and a pap smear by a doctor. Okay. Are Kegels exercises and pelvic floor muscle training enough to overcome vaginal laxity? Very important question, because we are very big in treating all sorts of female laxity, urinary incontinence problems, and many patients come to us despite all the Kegel exercises that they have done. The reason being, Kegel exercises is training your muscles, but it does not add collagen to your vaginal areas or even to the pelvic floor. There's also collagen structures holding everything up. So if you want to prevent urinary incontinence, which is suddenly leaking urine when you cough or sneeze on stress, urinary incontinence, or due to some nervous conditions you can have urinary incontinence, then you need to also strengthen the collagen structures together with the muscle structures. So then for vaginal laxity, we will offer many kind of treatments. Maybe we'll talk about it in detail at another session, maybe next session even. If you are interested, just let us know what's your topic of interest and I will talk about it. And vaginal laxity, for your info, ladies out there and even gentlemen, it's one of the most common problem that is affecting female after 30 years or 35 years, because that's when female finish their reproductive age. Sometimes they given birth to their children, and many people start to worry about getting cancers, but the incidences of cervical cancer is so much lesser than the psychological distress that is caused by vaginal laxity. So it's not a small problem and it's not a taboo subject that we should all hide about. This is something that we should address if we have it, and we should fight and get rid of this problem so you can proceed in your life and be successful in everything you do. So I think I've come to the end of my Facebook Live session. Thank you so much for being with me. I'll see you again soon next week. Until then, bye-bye. Stay safe.